So thank you to Professor Fabris. Welcome also from my side to this one-day conference entitled Biblical Wisdom and the Ethics of Eating, organized by Istituto, ReTe of the University in Lugano, Faculty of Theology. I'm Myriam. I am the chair of this first panel, and I'm very delighted to be able to share this panel with important and famous professors. The first professor, the first speaker, is Luca Valera, professor at the University of, what is the?
Valladolid.
Valladolid in Spain. I'm sorry, my bad. Studied philosophy at the Università Cattolica del Sacro Cuore di Milano. Me too, it's my colleague. He holds a PhD in bioethics and philosophy from the Università Campus Biomedico di Roma. His main research interests are philosophical anthropology, bioethics, environmental ethics, and the philosophy of new technologies. Since 2025, he has been director of the Department of Philosophy. He also adjunct professor at the Bioethics Center of the Pontifical Catholic University of Chile and an associate researcher at the Cape Horn International Center, always in Chile. Among his publications, I remember Protecting the Mind with Springer in 2022, Pantheism and Ecology, Springer published in 2023. And he also the author of more than 115 articles and book chapters. He has participated in around 140 conferences and seminars in different countries, and to date is involved in 4 nationally and internationally founded projects. So welcome also to my city, because Lugano is my city. And we have among 50 minutes, and then we'll leave the time for public questions. Thank you for joining us, and I leave you the floor, Professor Valera.
Thank you very much, Professor Di Marco, for the presentation. I want to thank Adriano Fabris for the invitation, and all of you for being here, have the patience of listening to my presentation. I changed a little bit my presentation. I will talk about health, food, and environment, and not health, food, and ecology, but it's quite the same. I will explain why I changed the title of my presentation. I will try to outline some ethical and bioethical considerations about the topic of food, and mainly the relation between environment, food, and human health. So, thank you. The first disclosure I have to make is that I will use a speciesist approach. This to say, I'm quite interested in this presentation to human health. So when I will talk about the environmental health or the animal health, I will talk about this topic in relation to human health. So the final aim of my presentation is the well-being of the human being, not only of the human being, but principally of the human being. And the second disclosure is that the photos are mainly taken from the exposition Cibo, we can go on, please, which is an exposition of the photographer Steve McCurry, and which talks about the topic of food in relation to the environment and social life, and we'll discover how these 3 topics are really relevant when talking about food. Go on, please. Thank you. So I will start with some current concerns about food, health, and the environment, just to describe the status questionis, the state of the art, about the relationship between these 3 topics. We have a problem, as you may imagine, in the relationship between food and environment. That is to say, food is the production of food is one of the activity with the greater, the most relevant impact on our planet and our environment. So just think the production of beef, for example, of prawns, of cheese, etc. The greenhouse gas emission for this production is really high. So when producing food for our nutrition, we are impacting and we are polluting the environment, and these are data that I think every one of us mainly know. Thank you. And agriculture, in this sense, is a really relevant impact when thinking at the environment. Just think that, for example, half of the earth is used, of the habitable land is used for agriculture. Or, for example, that the 70% of global freshwater withdrawals are used for agriculture. So the impact, all these data show that the impact of this activity for producing food is really high when thinking at our environment. So just think the relation of food and environment, and we have a great, a very relevant concern here. Next one, thank you. But there is another concern when thinking at food and health, and I have here an example, which is the example of obesity. Just think that half of the world is suffering this disease. I lived in Chile for 6 years, and I can testify that as you can see here in the map, almost 70 or 80% of people are obese due to their nutrition, and this is a very relevant health problem. So food can be a relevant health problem and a relevant environmental problem. The next one. So just thinking at the death rate from obesity, and in some parts of the world, for example, are dying 500 persons per 100,000 people, which is a very high rate. The next one. So the third relationship is between human health and environment, and as you may imagine, we have a problem here too, because, for example, due to the exposure of lead in 2019, we had a relevant problem which is described in this map. The next one. And the World Health Organization say that the total pollution is causing a relevant number of deaths, that is to say almost 7-8 million per year death are related to total pollution. So if the other causes of death may be the IDS, road injuries, drugs, etc., the total pollution is the most probably relevant cause for dying. The next one. In this sense, the World Health Organization says that air pollution is an invisible health threat. Next one. But we have another problem, that is to say, when we are trying to take care for people, when we are caring and curing people, we are polluting the environment. That is to say, at the same time, we are trying to care people from pollution, and caring people, while caring people, we are polluting and contaminating the environment. And this image shows what does, and the next one please, shows that almost 5%, the 5% footprint of every country is related to healthcare. Here in Switzerland, for example, almost 7% of the footprint is related to hospitals or pharmaceuticals, etc. And at the theoretical level, this is very relevant, because we are caring people, and while caring, we are contaminating, and in this sense, we are creating, the next one, a vicious circle. Lancet in 2020 published a very relevant special issue on the environmental footprint of healthcare, the next one, and I published a recent paper in bioethics on this topic and how we can solve this topic, which is really relevant in the scientific debate nowadays. So it is a vicious circle. That is to say, the relationship between health and pollution is quite curious. Pollution can be the cause of many diseases. As I said, almost 7 million of persons are dying every year due to the air pollution, but at the same time maintaining good human health can be the reason for more pollution. So healthcare is a source of environmental contaminants that negatively impact human well-being. So there is a sort of circularity between environmental pollution and healthcare. So it is a problematic two-way relationship between nature and human. We are caring people, and at the same time we are contaminating, and we have to care for the people that we are creating problems and illnesses. So we need some paradigm, and we'll retake this topic later on. We will need some paradigms to rethink at the problem, because the individualistic idea of health cannot give a correct solution to this problem. So so we have two main possibilities. In one sense, food, as I showed with the current concern, may be a great environmental and health problem, with the topic of obesity, as I showed, with the topic, for example, of the land use and the freshwater use for agriculture, etc. But at the same time, food may be, and this is the hypothesis of my presentation, may be a great environmental and health resource. It depends, obviously, on the paradigm we are using, and I will try to show and to offer a paradigm and some ethical consideration at the end of my presentation in order to show how it can be a great resource. Before doing that, I will try to disentangle the three main concepts I mentioned, that is to say, health, environment, and food, in order to show which is the relation between them. So I will start with health, which is, I think, the more complex topic to explain, because we have a very old, very ancient idea of health which doesn't correspond, which isn't consistent with the idea of health we are experiencing nowadays. In this sense, I say that health should no longer be understood as the absence of disease. I think the whole history of humanity thought about the health in this term, that is to say, we are healthy people when we are not experiencing any disease. And health cannot be thought as a state of complete physical, mental, and social well-being, as the World Health Organization said in 1948. Because our health, we discover that is interdependent with the health of domestic and wild animals, plants, and the wider environment. With the pandemic COVID-19, we had a great example of this topic. So both the individualistic, which is the first sentence, that is to say the absence of disease, the individualistic biomedical model of health and disease, and the biopsychosocial one should leave room for the One Health model, which is the actual model used by the World Health Organization to describe our health and illnesses, which considers inextricable linkages between ecosystems, society, and health of animals and the humans. So what is One Health? One Health, as you can see in this image, is a model that describes the relationship between our health, the health of the animals, and the health of the ecosystem or the environmental health. And here on the left, you can see that diet, security food, etc., are very relevant topics because One Health is mainly related to prevention, that regenerative medicine. So what is One Health? It is an integrated approach that aims to sustainably balance and optimize the health of people, animals, and ecosystem. It recognizes that the health of humans, as we can see in the image, animal, plants, and environment are closely linked and are interdependent, and the COVID-19 pandemic is a good example of it. And so, in order to approach this new paradigm, is very relevant the collaboration across disciplines that contribute to protect health, address health challenges, and promote the health of our ecosystem. In this sense, for example, food safety is really relevant here because food safety can be a very relevant mean and measure for the prevention of health and for a sustainable impact on the environment. By linking humans, animals, and environment, One Health help to address the full spectrum of disease control from prevention to detection, response and management, and contribute to global health security. So this is the main paradigm used by the World Health Organization to describe how we have some relationship with the environment and the other animals, and the topic of food is central here to describe this environment. The next one. So if we have a broader concept of health here, so our health is not only the health of our organism, but it is really dependent to the health of other organisms and other beings, etc. We need to reframe the same concept of the health determinants. In the previous image, you may saw probably that it was talking about the social determinant of health. We discovered recently with some scholars that our health is not only dependent on the life of other beings, but at the same time is really dependent on the society, on the structure of the society, on the well-being of our society. So when talking about health, we cannot talk about a very abstract concept because it is always related to the context where the particular human being lives and develops. So if the health is something that goes behind the individual, we must look for the determinants of health, that is to say, what are the main causes of our health behind the individual, interpreting the human being as the center of many significant relationship with other living beings, relationship with other human beings and non-human beings. So we need to consider the interaction between psychosocial factor. Living in Chile, I understood that it is really important because one normal disease may be a very relevant disease due to the social context the human being is living in. Just think, for example, as the private health insurance, etc., which is a huge problem in Latin America, for example. Between psychosocial factor, biophysical environment, and behaviors and life habits of each individual as health determinants. So our life habits, and food and nutrition in this sense is really relevant, should be a relevant determinant of health. In this sense, some scholars are talking about at the same time the social determinant of health and the ecological determinant of health. Just think at the topic of pollution I mentioned at the very beginning of my presentation. Regarding the social determinant of health, with a colleague, I wrote a paper highlighting that social inequalities are the underlying cause of disparities in health outcomes. And about the ecological determinants of health, we can say that global environmental hazards are the major ecological determinants with consequential effects on our human health. Is it something new? No, I cannot say this is something new, because if we get back to Hippocrates, the father of medicine, in his work, Air, Water and Places, health is defined on the basis of an equilibrium achieved between environmental forces on the one hand and the environment and the individual habits on the other. So Hippocrates knows very well that our health is something which is very related to our relationship between us and the environment and our life habits, and in this sense, nutrition has a great relevance. The second topic is food, also because in this conference, the main speaker will talk about food. I will not stress so much the topic of food. I will only give 5 words in order to understand, to give some keys to understand the relationship between health, environment, and food. And the next one, and the 5 words are need, culture, economy, impact, and sustainability. Evidently, food is something related to our needs. That is to say, food is vital to human survival in a way in which cars and mobile phones are not. So we need food to live. But food, as Adriano was saying in the very introduction of this conference, is and eating in particular is a cultural activity that goes beyond the mere nutrition. And in this sense, we are not the same as the other living beings or animals. Food is strictly related to economy, as I tried to show with the first state of the art. That is to say, food production is an organic process which depends on the exploitation of living resources. Just think at the land resources. Food has a great impact on the environment. The ultimate dependence of agricultural productivity on the capture of solar energy by plants involves use of extensive land area, which has implication for the completed claims of other industries and social amenity. And food may be the source of sustainability or unsustainability of our activities related to the environment. So sustainable food supply necessitates ecological and environmental stability and depends on the recycling of essential nutrients. And just looking at these 5 words, we can understand that we have 3 main entities which are really related to the topic of food. That is to say, the organisms, the environment, and the human being. Just thinking the human being as the sum of biological life and culture, and in this sense, the impact on the environment and the economy is a consequence of this cultural dimension of the human being. So this scholar, Myriam, basically says that, and I think it's very relevant, this table says that when thinking at the relationship between these 3 elements I tried to outline, that is to say organisms, human beings, and environment, we have some possible ethical concerns related to the well-being, to the autonomy, and to the justice with relation to this topic. So just thinking that the organism, the well-being of the organism may be translated in the topic of animal welfare, and the topic of justice, for example, may be translated with one of the central topic in environmental ethics, that is to say, the intrinsic value of nature or organism, etc. So when thinking at these 3 entities, we have, and their relationship, we have some ethical emerging topics that should be relevant when considering the environment and our health. I will not talk about this topic because I think the other colleagues will talk about them. So the next, thank you. The easier, I think the more simple concept is that of environment, because we have an intuitive now concept of the environment. We already know that environment is not only the natural life, and in order to talk about the environment, I will only quote the next one. A quotation from Adriano in a chapter of the book I published. He says about the environment, human beings have always interacted with the natural environment. They have transformed it to such an extent that they have often overlooked the consequences of their action, as it witnesses by the ecological emergencies we face today. In other words, the human species has always worked to make its world artificial by designing, creating, and using technological devices. Culture itself is the result of this process. The weakening of the equilibrium between biosphere and cultural sphere is what is producing today irreversible consequences for our planet. So when thinking of the environment today, we have necessary to think about an integrated space between natural life and human or cultural life. So technologies are in the environment, technologies are our environment, as the plants, in the same way, the plants and the other living beings are our environment. So just thinking of the environments, we need a broader concept, which is nowadays very used. I mean, broader concept of the environment, which goes beyond only natural life. So, in order to understand the relationship between these three topics, food, health, and environment, we need new paradigms if we are facing new problems and new concepts, because health is should no longer be thought as the individual well-being of the particular organism. At the same time, food is something more complex than in ancient time, and the environment we are experiencing nowadays is something really different from the natural life. We need new paradigms in order to offer an hermeneutics of the ethical problem we are facing today. In order to offer this hermeneutic, I will get back to two main authors in ethics and bioethics that I think are really useful when thinking at the problematic relationship between these three concepts. The first author is the father of bioethics, Frank Potter, which is famous for his main publication, main book published in 1971, Bioethics: Bridge to the Future, and the other book in 1988, Global Bioethics, and it is not the most used paradigm in bioethics nowadays, because the Georgetown paradigm is the most relevant one, and the Georgetown paradigm is the most famous paradigm in biomedical ethics, that is to say, the relationship between the physician and the patient, and the ethical problems emerge in this specific relation. So principalism, for example, of Beecham children emerged from Georgetown, etc. The paradigm offered by Potter is not so used because it is more a theoretical paradigm which deals with the relationship between the human being and their environment. In the very beginning of the book Bioethics, Potter talks about the most relevant bioethical problem, that is to say, we are, as he said, a cancer on the planet. So the most relevant problem in bioethics for Potter is not the abortion or euthanasia or in vitro fertilization, etc., but our environmental impact on this planet. We are like a cancer, he said. So the idea expressed by Potter is to overcome the short-term individualistic view of human health, which related to the ancient idea of health I was trying to explain before, and well-being by linking the survival of the human species with that of the ecosystem. And he said, we need to preserve the good health and force the requirements for global survival, healthcare, and health care. So, in the Potter's bioethics, the center is not the human health per se, but the interdependent vitality of all natural and anthropogenic ecosystem. And in this sense, he says healthcare and healthcare must go hand in hand. So at the end of the 80s, he was he had an intuition about the concept of health we are using nowadays with One Health. That is to say, there is a strong relationship between our health and the health of the planet. The next one. And in this sense, Walter Wright, which is one of the scholar which working on the Potter works, says that Potter reaction was based on this fear that the Georgetown approach, so that is to say the patient relation, the medical patient relationship to bioethics will simply reaffirm the medical profession inclination to think more in terms of issue of therapy to neglect of prevention. The main interest in Potter's bioethics was prevention, just as the main topic in One Health is the topic of prevention. So how should we prevent some diseases with correct life habits, for example? Because his field was carcinogenesis, he was aware of the strong link between medical problems and the carcinogens in the environment. Here we have Marta, which is an expert in cancer, so I won't talk about cancer anymore. Thus, his holistic way of perceiving health led him to the view that even the clinical therapists, and there was an intuition at the very beginning of the 70s, and it is really relevant, that the clinical therapists should be thinking about the need for environmental ethics. So Potter's intuition was not to eliminate the Georgetown perspective, that is to say, the ancient idea of the relationship between the physician and the patient, but just One Health does not eliminate the other concept of health, no? But to complement, enrich, and expand it beyond the mere individual or patient. He argues, to resolve the dichotomy between medical bioethics and environmental bioethics, I coined the phrase global bioethics in 1988, and this is the title of his book, which is dedicated to Aldo Leopold. The subtitle of this paper is Building on the Leopold Legacy. Aldo Leopold is the father of land ethics. So in this sense, when thinking at bioethical problems, he says that the most relevant topics are the environmental topics, also thinking at our health. And the second person, the second thinker, when thinking at this systemic approach about health, food, and environment, I think is Arnnes, the father of the deep ecology movement. He says that we are like knots in the biospherical net, and we are deeply connected to other forms of life, and our self-realization depends on the realization of the other forms of life. One Health just express, not in a normative way as Ness is expressing in the sense that the realization of our well-being, our realization and our well-being depend on the well-being of the whole system. So due to this original interconnectedness, the main principle regarding our relationship, and it is an ethical principle, not just a descriptive principle, to nature should be cooperation. You and I, not either you or me. Live and let live is a more powerful ecological principle than either you or me. So at the ethical level, we can translate this principle and apply this to the idea of the different relationship between food, health, and the environment. The next one. So I will conclude. I gave like a very brief state of the heart of the relationship between the three topics, the three main concepts in the title of my presentation. I tried to disentangle these three concepts and to explain how this concept should be reframed nowadays due to the different change we are experiencing. And I gave like two paradigms that should be useful to interpret the ethical and bioethical problems when thinking at the relationship between these three concepts. Now, as a conclusion of my speech, I will give some ethics and pragmatic consideration. They are not like principle, like the principlism. So I will not talk about very abstract principle to apply to some concerns, ethical principle, but I will give some pragmatic consideration in order to give a better relationship between these three topics. So the first one is the need for prevention and promotion of good lifestyle habits, and in this sense eating is really relevant both for the environment and our health, so the health of the environment and our health. A focus on the human well-being and care is needed. This follows from the idea of health as a continuous and complex interaction, just think in one health, between humans' habits and the environment. The focus on good lifestyle habits and balanced behaviors like healthy food habits may help environmental sustainability and promote health. This implies at least two consequences. First one is that prevention, for example, food control and safety, is the best option and the most effective solution. Just think at the footprint of healthcare institutions. So we can help solving this problem with the pollution of healthcare institution if we make better prevention, just at the life habits like nutrition. In this regard, caring should take priority over curing, and this is the dichotomy between Potter and Jordan, that is to say, a preventive medicine or a regenerative medicine. Driving medicine to be more preventive than regenerative and to focus more on well-being rather than on therapies. The second consequence is medicine should also be concerned with healthy individuals and not only with the sick one. Health individuals and their environments. So we have to create the better environment for allowing the human being to develop in the best way possible. This will help continuously maintain the well-being of the individuals and their environments rather than reacting to tragic or catastrophic events. In this sense, the prevention and promotion of good lifestyle habits is the best option for me. The second point is a systemic focus when thinking at this topic. So the pursuit of ecological and healthy sound decision must go beyond the individual. We should think at our health behind ourselves. If the individual is a part of a socio-ecological system, just think at the social determinants of health and ecological determinants of health, we should simultaneously take care of both, since the health and the well-being of the former depend on the health and the well-being of the latter, and vice versa. Just think the ethical norm expressed by RNS, not either you and I, but you and I, both you and I. So the third point is with the concept of One Health, we should have a win-win approach. That is to say, the concept of One Health pushes us to leave the dichotomy between anthropocentrism and biocentrism, which is a hot topic in environmental philosophy and environmental ethics, pointing at a common purpose, planetary health, that also has positive consequences for particular interests. That is to say, individual health. In this sense, I talked at the very, I made this disclosure at the very beginning of my presentation, and I'm, in this sense, a specialist. I'm interested now in our health, and in this sense, the health of the planet, the environmental health, is instrumental to our health, in this sense. This approach aims to make conscious choices in the context of food and diet in order to reduce our impact on the planet, move towards environmental sustainability, and enhance our well-being. So, well-being is just to say that caring for the planet, and in this sense, RNS is really realist in this point, caring for the planet is at the same time caring ourselves, and in this sense we should have a positive consequences when thinking at our possible sustainable activities related to the environment. And the last point is more an epistemological point of view, that is to say we need some epistemic humility. The complexity of the current ecological dynamics invites us to epistemic humility and prudent or precautious approaches to events with uncertain consequences. This approach would lead to a technological conservatism or better realism rather than techno-fix approaches, that is to say try to fix the problem of the planet with technologies, because we should remember the second law of ecology expressed by the ecologist Barry Commoner, which is nature knows best. That is to say, when you try to fix an environmental problem, you are probably creating a bigger problem at the environment. So just think the possible negative consequences of your impact in the planet. I just think, for example, a genetically modified organism. We should be very cautious and prudent when thinking at the possible technological intervention. So techno-fix is not the best solution, even though in the contemporary debate it is like it is presented as the very relevant, as the most relevant solution to environmental problem, like with geoengineering and something like that. So thank you very much for your patience. And in the last slide, I have some references. If someone is interested in the paper I mentioned. Thank you.